Hello, I am P. Shakir Ahmed, a medical student of Jonalda Foundation School of Medicine. Now I will be present the Leopold's maneuver. For that, I will ask the patient to empty bladder and abdominal area should be adequately exposed. Except abdomen, all area should be covered for patient privacy. Before starting the procedure, I will take consent from the patient and explain the procedure. For I will ask the patient to lie on supine and with semi-knee flexed. I will stand on the right side of the patient. For first, second and third Leopold maneuver, I will perform to facing the patient face, and fourth Leopold maneuver, I will perform facing towards the feet of the patient. I will measure the fundic height from the pubic symphysis. Fundic height is equal to the age of fetus. Touching the patient, I will warm my hand or rub because cold hand can stimulate the uterine contraction. I am going to present the Leopold's maneuver 1, also known as the fundal grip. For Leopold's maneuver 1, I will stand on the right side and facing toward the face of the patient. Leopold's maneuver 1 tells us about the fetal presentation and fetal life. Both hands goes gently on the fundal area and palpate and tells us what we feel. If we feel bold, irregular, soft, that means is buttock area, means cephalic presentation. If we feel hard, firm and nodular structure, that means his head, means breech presentation. And it's also tell us about lie. If we find out head or buttock on the fundal area, that means longitudinal lie. And if we don't find head or buttock, that means it's transverse lie. Now I am going to perform Leopold's maneuver 2, also known as fetal grip. For Leopold's maneuver 2, I will be stand as same as Leopold's maneuver 1. Leopold's maneuver 2 tells us about the fetal position. To perform Leopold's maneuver 2, I will shift my hand from the fundus area to lateral side of the abdomen or the paraumbilical area. First, I will stabilize the fetus by one hand on one side and gently palpate the another hand by another side. Similarly, I will do the another side, and if I feel hard, regular, curve-like structure continuously, then it is fetal back, and if I feel small, multiple knob-like structure, that means fetal limb. If the fetal back is in left side of the abdomen, then fetal position is LOT, LOA, LOP, and if the fetal back is right side of the abdomen, then fetal position is ROT, ROP, and ROA. Now I am going to perform Leopold's maneuver 3. It's also known as the poly grip. For Leopold's maneuver 3, I will stand toward facing the face of the patient. It tells us about the fetal presentation. Now I will place my right ulnar border of the right hand on the pubic symphysis and make a cup-like structure and try to feel what we are feeling. If we feel hard, round, globular structure, it means it's head and cephalic presentation. Now we will try to move the head. It's called ballotable. If it's move the heads, it's free head, and if the head does not move, it means it's engaged on pelvis. Leopold's maneuver 3 tells us about the cephalic presentation or breech presentation. Now I am going to perform Leopold's maneuver 4. It's also known as the pelvic grip. For Leopold's maneuver 4, I will change my position. I will facing towards the feet of the patient. It confirms about Leopold's maneuver 3 and tells the attitude of the fetus. For Leopold's maneuver 4, I will place my both hands on the bilateral lower quadrant and going down to up to the pubic symphysis and gently palpate. If we feel hard, firm, globular structure, that means cephalic presentation, it confirms the Leopold's maneuver 3, and I will try to move my hands below the head of the fetus. If both hands are converged, that means fetus head is not engaged. If my both hands got diverged, means fetus head is engaged. If I feel fetal head on the same side of the fetal back, that is means fetus head is extended. If the fetal head is same side with the small part, that is means fetal head is flexed. Thank you. My Leopold's maneuver procedure is done. Thank you for your cooperation.